Good morning, my YouTube viewers. It's Palestine here, and I wanted to make another video that was a carry-on from yesterday's video, because yesterday I made a video where I talked about where I saw the surgeon, and in this video I also was talking about Eamon and Beck, who have a YouTube channel. You can probably look it up. And they also have a podcast called Reroute with Eamon and Beck. And I don't know why they call it Reroute, but they do. And basically, this particular video is going to be about not everybody survives cancer. In my particular situation, I was supposed to get a mammogram every 3 years. And so they picked it up in the 3 yearly mammogram. And so I don't know how long I've had it. In the last mammogram I had, they didn't pick anything up, and this mammogram they did. So I've had it for less than 3 years, 3 years or less. But I also wanted to say that, obviously because of my financial situation, I have to go to food handouts. And when I go to food handouts, we did meet this guy. He was a nice guy, and he had been in the Army, and he had a partner, and his partner had died of cancer, and he couldn't handle it. So I guess he started drinking and taking drugs, and so he found himself homeless, So that's one example that I know of somebody who didn't survive cancer. Not everybody survives cancer. They say it's not a death sentence, but what it is, it's an autoimmune disease. And it's an autoimmune disease. And so if you have an autoimmune disease, then you're more prone to getting cancer, like people who have rheumatoid arthritis. That's an autoimmune disease. And I do actually know someone, this was years ago, she had rheumatoid arthritis, and she had to have her joints replaced because of the arthritis, and she actually died of breast cancer as well. I heard from somebody else that she had died of breast cancer. So if you have an autoimmune disease, then you're going to get cancer more likely than someone who doesn't have an autoimmune disease. In my situation, I have diabetes, and that's a difficult situation. So I don't know. I'll have to look it up and see if people who have diabetes are more prone to getting cancer. That's one thing that I will have to research. But in my case, I know that I got cancer from stress. I've had a very stressful life. I've had a lot of very traumatic experiences where I got little, if any, support. And then if you have a lot of stress, it's going to affect your immunity. And since cancer is an autoimmune disease, then stress is going to bring it on. And that's why I originally decided to make this YouTube channel, was to talk about all of my very traumatic experiences. And maybe at some point when I get this cancer business sorted out, I'll go back to talking about my traumatic experiences, because these traumatic experiences, number one, made me the person that I am today, and number two, caused my cancer. And yesterday I phoned my mom, because I phoned her on Skype, because Skype is coming to an end. And I thought, well, I'm going to phone her as much as I can, because Skype is coming to an end. And I can go into Teams, but I'll have to try to go into Teams, see how that works. But I do have a number where I can ring her supposedly for free. So I'll try that number as well. And I did say to my mother, I said, I got this because of stress. I got this disease because of stress, and also because I was forced to take psychiatric medication. And I do believe that there is evidence to suggest that psychiatric medication can bring cancer on. And one of the drugs that I was forced to take was risperidone, and it is a mind-altering drug. And I looked it up on the internet, and they said, oh no, risperidone doesn't cause cancer. In fact, it's used to treat cancer. Because one of the things about risperidone is that it has an effect on your lactic acid. And then when it has an effect on your lactic acid, well, what's breast cancer? And so, and then I also take a reproposal. And I don't know if a reproposal causes breast cancer, but it has a lot of really major side effects, one of them being death. So, because I was forced to take these psychiatric drugs, I do believe that they brought it on as well. And what I was talking about in my video yesterday, I was talking about Eamon and Beck. They have a YouTube channel called Eamon and Beck. So you can look at Eamon and Beck's YouTube channel or Reroute with Eamon and Beck. So one of the YouTube channels is where they're going traveling. And another one of their YouTube channels is when they have a podcast. Well, I found out about Eamon and Beck from somebody who's not my friend anymore, because he turned out to be a serial fraudster, and he defrauded my boyfriend and myself out of a not insignificant amount of money. And I think that he is the one that introduced us to Eamon and Beck. Well, the thing about the reason why I went back yesterday and I watched some more Eamon and Beck videos. And the thing about Beck is she was diagnosed with breast cancer. And so she had a lump in her breast, and then so she had a lumpectomy, and then she had to go through chemotherapy. But after she had her lumpectomy and her chemotherapy, what happened then was, I don't know if they told her not to do it. I don't know if they gave her estrogen blocking drugs. But then she tried to get pregnant. She got pregnant on her own. So I don't know if she was taking estrogen blocking drugs and if that affected her ability to get pregnant. But she did get pregnant, and she did want to have a baby. That's something that she wanted. And I do believe that all those hormones in the pregnancy caused the cancer to go out of remission. And the reason why is because when you're pregnant, everything in your body speeds up. And so I think the hormones in the pregnancy caused her to get the cancer again. And then what had happened was the cancer had gone into her bones, because she was saying that her back was hurting. And then she found out, I don't know what happened, but she found out, she was told that she had stage 4 cancer. And the reason why is because the cancer had gone into her bones. And then so what happened was they had to go to, I believe it was Toronto, because they're Canadian. They had to go to Toronto, and then she had to have a C-section. So they gave her a C-section, and they removed her ovaries. And the baby was born prematurely. And I'm not sure of all the ins and outs of that, but she didn't make any more videos for a while. But she had this stage 4 cancer, and I don't know if she decided that she didn't want to take any more cancer treatment, because it is a very hard treatment to undergo. But when I was watching the videos yesterday, the baby's like 15 months old or a year and a half old. And from what I gathered from the comments, is she's not doing any more cancer treatment. And so this cancer is just ravaging her body. And since the cancer has gone into her bones, she's actually got a tumor right here on her forehead, and you can see the tumor. And what she's doing is she's meditating, because she says she's in so much pain that she has to take morphine. And the simple fact that she's able to get around and do things on morphine is a statement in itself, because morphine makes you really tired and it makes you want to sleep, and she's going around doing things even on morphine. And I don't know what's going to happen. She knows she's going to die young. And yesterday I was watching a video where they interviewed her, and she didn't say that she wasn't on any more cancer treatment, but she said she was meditating like 2 hours a day, and that was like trying to help with the pain. But one of the other comments, somebody said that she wasn't getting cancer treatment. So she knows she's going to die young. I don't know when it's going to happen, but she knows she's going to die young. And then these sisters, Nolan sisters, the Nolan sisters, they had cancer. And recently, one of the Nolan sisters died of breast cancer as well. And she'd fought it for years and years and years. But finally, she succumbed to it. So breast cancer is a very serious disease. Not everybody survives it. I mean, my aunt, she had breast cancer that was caused by hormones. And so because she had a nice job, she had, they gave her a mastectomy and a reconstruction. But I'm not going to get anything like that on the NHS. I'm pretty sure. But not everybody survives it. So I'm not trying to be negative, but I'm just trying to be realistic. And, I've got problems of my own. I keep trying to worry about my weight and lose weight. And then yesterday when they weighed me, it wasn't what I wanted it to be. It went up, not down, and got to worry about that. And so I do have problems of my own about my weight and having cancer. But I just wanted to make this video to let you know that not everybody survives cancer. They say that it's not a death sentence, but it's not a life sentence either. So thank you so much for watching my video. If you like my video, please like and subscribe. I noticed that I lost one subscriber, which I don't have that many, but I lost one subscriber. I guess they didn't want to hear me talking about cancer. I guess they wanted me talking about my really bad experiences. And I will, if I get through this, I will talk about my bad experiences. But I just felt that, obviously having cancer needs to take priority. And I can't sit here and make videos about my bad experience when I'm going to be going through cancer treatment in a month. So again, thank you very much for watching my video. If you like my video, please like and subscribe. And I will see you next video I decide to make.